I'm Danny Prentice. I was Kirchhof when I was at DU. I was there from 2007 to 2011, and I majored in biology. Nikki, you can go ahead.
Okay. So I'm Nikki. It was Nikki Brown at DU and now Nikki Strecker. I was there from 2005 till 2009. Actually graduated with a degree in psychology, and then minored in biology and went to medical school from there. Grace, I'll pass it on to you.
I am Grace Broadhurst. I was on the team from 2015 to 2019, and at DU I majored in biology. So Ellese.
All right. I'm Ellese Sakai-Hart. I was at DU from 2011 to 2015. Hopefully, Paige, you can cut that out. And I majored in biology as well.
So what's everybody doing these days?
So I am currently doing a maternal fetal medicine fellowship or a high risk OB fellowship in Hershey, Pennsylvania. So I'm taking care of high risk moms or high risk babies and learning how to do that and doing some research with that as well as I finish my fellowship.
What kind of research are you doing?
So I am really interested in exercise and pregnancy, and I am starting a project. It's actually a animal project with mice, looking into obese pregnant mice that are either sedentary or exercised, and looking at markers of inflammation or oxidative stress between the two. There's some really, really cool work out of MassGen, where one of the MFMs there looked at obesity related to those things. And I want to see if exercise just prior to and during pregnancy can mitigate some of those changes they saw in obesity in those mice, in the offspring.
Wow, that's really interesting. Very cool. And what are you, have you found any preliminary evidence?
We're just getting it started. I just got grant funded through our department. So I have the money and I'm starting to order everything now. So
oh, cool.
What about you, Nikki? What are you doing? Where are you at?
So I am back in Louisville, Kentucky. It's where I'm from. I, after graduating from DU, went to med school at University of Kentucky, and then did residency at University of Louisville. It's a med peds residency, which is combined internal medicine, pediatrics. So it's a 4-year residency, and then finished that about 3.5 years ago, and then started in with a private practice in primary care in the outpatient setting. So I am in primary care now, and we see everything from newborns all the way up till not newborns, more elderly patients and Medicare patients, and yeah, just sort of general primary care. What about you, Grace? What are you doing these days?
So I am currently working in clinical research at National Jewish Health here in Denver. I am working as a coordinator for a COPD study, which actually has 12,000 patients, not 12,000, 11,000 patients nationwide, 1,200 actually here in Denver. So it's a really large study. And basically what I do is I recruit patients to come in for their study visit. I then run the study visit, including all of the different things that we do, breathing tests, physical tests, blood draw. And then once that's done, I am in charge of entering all that data and processing all of our samples. So it's really fun to interact with our patient cohort. I would eventually like to go to medical school, and so I'm in the process of studying for and taking my Mcat, and then hopefully applying to medical school this next cycle, which is really exciting. I know, Ellese, that you went the PT route. Is that correct?
Yeah, I did. I was gonna say I'm the outlier here, but that's okay. That's great, Grace. When do you take the Mcat?
Hopefully March 13th. With COVID, it kind of might change things a little bit, but I'll just go with the flow and, roll with it, I guess. We'll see what happens.
Yeah. Well, good for you. That's exciting. It's like a stressful time, but I feel like at least you can study and, not have too many other things to
I can't
tie
go
you down.
because there's nothing to do. So I just get to stay home and study.
Nice. Yeah, I actually graduated from University of Southern California for physical therapy school in May of 2019. And then I'm now working I'm in Northern California, working at Stanford in the outpatient neuro rehab facility there. And yeah, I've been working there for about a year now and really, really love it. I'm seeing patients, primarily an elderly population, but it kind of ranges from, maybe 40s to 50s up till 80s and 90-year-olds. See patients post-stroke, patients with MS, Parkinson's, very specific, different disorders that I didn't really learn about in school because Stanford has more of a specialty clinic in movement disorders. So I see some patients with things like dystonia. But yeah, it's really a good place to start out my career, and it's been really interesting. So yeah.
That's really cool.
Thanks.
So how has everyone's sort of career path currently, Grace, you sort of mentioned it a little bit or alluded to it, been affected by this whole COVID mess?
Yeah, no, so we never shut down our study, which is really great, but we had to kind of turn everything to virtual. We had to adapt to that, which was interesting. Our patient cohort is anywhere from 55 to 80 plus. So that was kind of fun, reaching out to them and calling them on the phone and running through all of our questionnaires over the phone. It was good for, both sides. I feel like they got to talk to somebody for a couple hours, and so did we, instead of just doing office work. But other than that, we've been kind of chugging along and just adapting to what we can and, not doing what we can't.
Very cool. Kind of like Grace said, at least in my research areas, they shut down a lot of the lab work, and they shut down a lot of the internal grant funding because they didn't really know what was going to happen as far as financially with the crisis as well at the hospital. So I did a postpartum depression study that was survey based, and we were able to call a lot of patients, and people were really receptive to talking to us, I think, because people had nothing else to do. And so we were able to get really great results on that and talk to a lot of people, and had a really, really awesome survey response. And then just as far as taking care of patients, it really, sort of like you alluded to earlier, Nikki, it really changed how we see patients. We do a lot more telehealth visits now. And for a long time, we were doing solely telehealth consults for maternal fetal medicine. And we had separated into two totally different teams, with an inpatient team and an outpatient team. And so I was part of the inpatient team, where we would, just to kind of save staff in case people came down with COVID, we would see like only the inpatient MFMs. And then we had a team that stayed home entirely and never went to the hospital and only saw like the telehealth visits. And so it really pretty much drastically changed a solid 9 months so far of my fellowship.
Yeah, I can definitely attest to the willingness of people to talk. We sort of kind of revamped everything as well with telehealth. I think in Kentucky, we were sort of slow to start as far as COVID cases were concerned. We're certainly not a, kind of a border state or on a coast. And so it took a little bit for it to move inland for us. But by the time it hit, we were pretty well established doing all telemedicine, just kind of seeing the writing on the wall in the other parts of the country, and did solely telemedicine for several months, and then sort of began to incorporate back well visits and things in the clinic. One thing I think from a pediatric standpoint that we really tried to hunker down on was that it was so important still for kids to get their routine vaccinations. And so even though we were doing telehealth, we all physically went to the office every day so that we could still see well checks and get kids in to get shots and things on time. So we didn't have a bunch of delayed vaccine schedules later on. And then we have actually maintained some telehealth now, even though we've mostly have everybody back in the office. We still do a couple hours a day of just telehealth at either high risk patients or just bodies that don't need to physically be in the office and potentially be exposed or expose others. And so we are kind of slowly, I think we're going to see that shift back in Kentucky. We're seeing cases rise like crazy right now. So I expect over the next month, probably, we will probably be shifting back again more towards telemedicine, but it'll be interesting to see with flu season and things. We are going to have to definitely see sick patients in the office and sort of differentiate who's COVID, who's flu. And I'm still not entirely sure how that's going to work out. So we'll follow up on that one. But I agree, Danny. It was interesting when we first started telemedicine. It was so foreign to everyone. They were like super quick, short visits. Everyone was like, oh, this is really weird. I'm fine. Can I just get my medication refilled? And then by about 3 weeks in, everyone was going stir crazy. And all of a sudden it was like 30 minutes. I'm like, hey, I got to get off the phone. We have other appointments. But they would just carry me around on their phone, walk around the whole house, just chit chatting, like turn me around to see their whole family, the dog, everybody. And I'm like, okay. But you definitely saw that as the quarantine went on longer and longer, people wanted to talk more. I think just seeing another face, just to talk to somebody that wasn't sort of barricaded in their house with them.
Absolutely. And for us too, I think it is really interesting because it's going to be something that becomes really permanent part of what we do. We have people that travel to us from more rural areas of Pennsylvania. And so we have patients that come like 2.5 hours, 3 hours for their consults. And really, we don't do very much except unless they're coming down for an ultrasound, which in case it's really easy to see them for that. But for some of the more just consultation-based things, it's become so much easier to do that with, and then they don't have to travel 3 hours to come see. So it's really interesting how it's probably totally changed how we're going to do things in the future.
Yeah, I think it has definitely forced you to be a little creative. And also, again, sort of risk assessment all the time about what it's worth the risk, what's not. Yes, I really want to see that patient, but maybe we can do telehealth and just have them come in for a lab appointment. That way they're in and out in a few minutes instead of sitting in a waiting room and seeing us physically in the office. And so I think, I think the way we practice medicine has definitely changed forever. And I think some of that's very good things for patient care and access to patient care. And it'll be interesting to see what happens as all this sort of smooths out over the next couple of years. But I do think some very permanent changes will come from this.
Absolutely. What about you, Ellese? How's it changed what you do?
Yeah, I think, there's things that are similar in terms of, generally for healthcare, moving towards more telehealth and telemedicine. But from a PT standpoint, or even just therapy standpoint, it's definitely, like everyone said, forced you to be more creative. It's really hard to decipher, like you're saying, Nikki, about risk factors. It's like, do you see this patient in person, or do you see them, or you request home health, depending on if they just had a fall? How high risk are they that they really need the physical therapy? So, I mean, going back to with COVID, we started, I think, seeing some in person back in June. But before that, just when it was all first starting, we moved to telehealth pretty quickly, which we were fortunate to do. But it was a lot of like checking in, calling, like, do they want to even try the telehealth? Most people are like, let's defer and wait till you're back in person. But then when it became longer and longer, more people were like, okay, well, maybe we can try to make it work. But yeah, it is hard from a safety standpoint too, especially for physical therapy. A lot of our patients are at really high fall risk. So that's one of the biggest factors is there someone there to help with the camera, or like help, like, assist if needed. It's a lot of like making sure they can set up the camera and set up a chair, set up the environment. So, you mitigate like them falling on this during the session. So yeah, it's been really interesting. I think, we have split telehealth and in-person days. And then some days I have both, but I'm not like at home or anything. We just like kind of go off into our little corner and do our video visit and then run to do our in-person. So it's a little hectic, but I've gotten more used to it. So
yeah, I can say we for sure have utilized home health like crazy. Personally, my husband needed physical therapy in the midst of all this, so we kind of waited till June-ish, and I sort of used him as the guinea pig, getting back into like in person before I sent my patients to sort of see how he was going to do. He's otherwise healthy, and I knew where the PT he was going to see was very safe, and it was going to be in a good environment. And he felt like it was super safe to do. But I have patients even now that are very nervous about doing that, and so I have so many Medicare patients in particular utilizing home health right now, and those resources are also becoming more scarce as a result of that. But it's been a huge part of this pandemic from a primary care standpoint.
Yeah, that makes sense. I mean, we have all the patients who are, already fairly sedentary, and then this really just made that even harder for people.
Right.
And yeah, it's a combination. It's hard.
Danny, when you said you were doing that study with the postpartum depression, did you feel like compared to sort of baseline of what you were used to seeing previously, was the percentage of patients with postpartum depression or with symptoms of postpartum depression or anxiety just skyrocketing?
So for the study, we actually stopped so we collected data from 2015 to 2019. So that wasn't part of the study, but just in general, there's a lot of anxiety right now during pregnancy and after pregnancy. And we've been scheduling a lot more people for telehealth visits to check in on them 1 week, 2 weeks, 3 weeks postpartum to see if they're doing okay. And even some of the women that I talked to who weren't currently like immediately postpartum or in that period of time, they were going a little bit stir crazy and having a lot of anxiety being home all the time with the kids too, and trying to figure that out. So that would be a really interesting aspect to look at to see how much that increased during the period of isolation.
Yeah, I can definitely say, just clinically speaking, within my practice, it is insane, the change in mental health. I mean, I do a ton of mental health stuff on a daily basis anyway. But the following up with people through this pandemic, and particularly postpartum women, have seen a huge change, that isolation at home and not feeling like they could ask family to come over to help, or, grandparents, and not being able to sort of share the joy with their family of the new baby. But then also when they are struggling, they don't feel like they have anybody that they can ask safely to come help. And it's been difficult to watch, honestly, because there's just only so much you can do. And sort of like you said, weighing risk and benefit kind of situations. But there's no mental health resources across the country. There's just completely inadequate. And in particular, that is highlighted dramatically in a pandemic setting like this.
Absolutely. Yeah, it's interesting listening to everyone talk about how we've had to adapt to COVID, and it made me laugh a little bit thinking about Melissa always telling us to expect the unexpected.
I was just about to say the exact same thing. It was like this whole year just been playing in my head of expect the unexpected. Every single time something happens.
I know. Sorry, my dog's barking, but yeah, because what could have been more unexpected than this? So I think that obviously being a student athlete helps you be able to be flexible and try to come up with innovative ways to get by when something stands in your way. Do you guys have any other ideas of how being a student athlete kind of helped you in your career?
I think for me, it gave me a lot of confidence entering like my first real person job, I guess. It gave me a lot of confidence in dealing with high expectations from your boss. We as student athletes had such high expectations for ourselves, but also from our coaches, both athletically and academically. And, transferring that into a work setting, you are given lots of different tasks and lots of different things. And I think I just kind of felt comfort in the fact that I know I've dealt with a similar situation of dealing with that high expectation and also delivering on that high expectation. So I think it just kind of gave me a great sense of confidence. I didn't have to stress about all that was on my plate because I know I could handle a lot on my plate. So I don't know if anybody else feels that way, but.
I guess I would say that, it has helped me in different ways throughout like the process of, after being a student athlete and then through school or grad school. I think grad school is a whole different animal compared to just even undergrad. So I think the demand level of trying to take care of like your physical body, your mental body, all of that was something that, we learned as student athletes. So I think that helped to transfer over. And then even just the idea of goal setting, I think has been just like crucial in terms of like being successful throughout, school, throughout careers, all that. So just knowing what you want and figuring out how to get it, I think is something that we learn as athletes. So
Absolutely.
I was definitely going to jump on the goal-oriented piece of things. I feel like that's hammered in, especially with gymnastics, so young, even before you think about student athlete in college. But, both sort of short-term and long-term goals, seeing the immediate future and how to get through that day or that class or whatever, but then long-term goal and sort of having all those things in mind. I think for me, the biggest factor was probably time management, which again, I think you learn from so early on because gymnastics just requires so much extracurricular time outside of school from such a young age. But I think, you go through all of high school and, college, it's class in the morning and then practice at night, and you'd finish at 8, 9 o'clock, whatever, and go home and do homework and then go to bed. And that was, accounted for pretty much every hour of every day. And that's just what you did. And I feel like I got to med school and I had a lot of friends that really struggled with the idea of having scheduled activities or scheduled required things all day long. And to me, it was just normal. That's what you did every day. But instead of going to school and then going to practice for 5 hours, I would go to class and then I would go to the library for 5 hours, right? So you just sort of transition from one activity to another, but it was very normal for me to have that fully scheduled day to kind of stick with. And I think I definitely had friends in school that really struggled with that concept early on. And just really kind of losing some of that free time that we were never used to having anyway. So I actually felt like I had all kinds of free time, that I could, do things with friends or family, and that you just didn't, really have. I don't think anyone else really had that experience. I think it definitely gave you a leg up being prepared for that setting.
Absolutely. I think it also like really gives you an aspect of resiliency that other people in medical school might, and other grad programs might not have had to come up against before. I know Nikki knows this, but my career ended my sophomore season after tearing my ACL and my 4th knee surgery, and coming like out of that and trying to make the most out of that like really painful experience that felt like a really big failure at the time. I think taught me a lot about how to fail in med school and how to make mistakes in medicine, because it's something that's really entirely inevitable, and how to learn from those situations and to do better next time, and how to continue to grow and not let it just entirely crush you and ruin you, which I know I've seen with people in medicine and people in med school before. So I think that's something that's really important too, is you kind of learn how to fall and then get back up again and try again.
Literally and physically and figuratively.
Yeah. So. Anyone have advice for anybody? I know.
Where do you begin? No. No, I mean, I think it's everything that we just said. You know, I think it's knowing what you want and finding out how to get there and using the resources that you have available to you. I think one of the things that was so appealing to me about DU in comparison to other schools, when you go on visits and things, I don't even know if they're doing those kinds of things anymore in COVID world, but you know, when you go and talk with the coaches, I think Melissa and the coaching staff when I was there were very upfront that academics was very important and that they were definitely on board to allow you to pursue those things and you know, wanted you to achieve your goals in and out of the gym. And I didn't get that feel everywhere I went. And so I think placing yourself in a position to be successful to achieve your goals is sort of the first step. But I think you know, being a student athlete, having tutors around and having the study hall and you know, just all of those resources that may not have been available to you otherwise. And you also have sort of a close-knit group of friends almost immediately, right? Not just on the gymnastics team, but all the other student athletes. I felt like in a lot of my classes, there was a lot of swimmers. And so, you know, making study groups with them, which was helpful because you knew they were going through the same things you were. They were under the same time restraints. They had travel. They had you know, swim meets on weekends, and so it wasn't like a put things off to the last minute kind of situation. So I think using the resources that you have and sort of that dual advisor position that you'd have your advisor from your major, but then also sort of the athletic academic advisor and using both of those to your benefit is a huge piece of sort of figuring out how to jumpstart from the student athlete world into sort of the what's next phase of life.
Definitely. I was going to mention just utilizing all of the resources available to you because there are so many that we all were really lucky to be able to use. I know I used the tutors to get through OChem because that was not my favorite class.
Yes.
You use that so much in medicine, right?
every day. So I was able to do that. And then actually, like, I did research in the lab in neurology, and I made some really good friends through that. And now I'm kind of applying what I learned in that into my not neurology project. So it's really interesting as far as that goes. And then I guess the only other thing I would say is there are going to be people who ask you if you're doing what you really want to do every single step of the way and tell you how hard it's going to be. And if that's really the way you want to go. And if it's really what you want to do, go for it. Don't let anyone talk you out of it. So that's my biggest advice.
I think my biggest advice, as cliche as it sounds, is, you know, the 4 years goes by very, very quickly, and it goes a lot quicker than you'd expect it to. And to just really be present in the moment and, you know, take everything that you experience, the good and the bad, and just learn as much as you can from it. Because ultimately it's going to help you down the line in way other different situations. But you just learn so much. So I think it's important just to be present.
Yeah, I think that's a great, another Melissa kind of
quote
there. But yeah, I think my advice would be that, you know, obviously I started thinking that I wanted to go to med school since I was really little. And then somewhere along the way, I felt like there was another kind of calling for me. And I think it's okay to, you know, change your mind even towards the end of your undergrad career. Like, from now thinking about it now, it's not that big of a deal, but in the moment it was like, oh my gosh, you know, what am I gonna do? Like, this is what I had my mind set on. So I think what really helped me was talking to a lot of other people, doing a lot of shadowing, informational interviewing. You know, there's a lot of, like everyone's saying, resources with that at DU. Oh, so cute. And, you know, I think it is about, you know, finding your passion and finding, you know, what motivates you, and whatever that is, it's totally fine. So, yeah.
Yeah, I think it's, like, I wasn't a biology major, I was a psychology major, but taking most of the same classes. I mean, it's definitely tough going through with athletics too. you know, and I have no idea what the schedules are built like now, but it was all night labs, right? Because labs all happen during practice. And then Friday morning, at least when I was there, I felt like there were no classes on Fridays because everybody just went skiing every weekend, except if you were a biology major. And then chemistry and, you know, physics was in the afternoon, but chemistry was always 8 a.m. Friday morning. And so, I mean, I had roommates and teammates and most everyone else I knew on campus that didn't really go to class on Fridays and just sort of hung out, and, you know, we had like Monday, Wednesday classes and Tuesday, Thursday classes. And so it was a different schedule, and the night labs are pretty awful. But I think it was Grace sort of alluded to it earlier. I think it sort of teaches you, or maybe it was Danny, that resiliency that, you know, you get through it and it's tough, but if it's what you want, then it's worth it, and you'll sort of see the other side eventually. But God, the 8 a.m. Friday morning class was tough. Nobody else had to go to class.
I know, the whole campus is empty and you're like, wow.
Yeah, let me just walk through the snow to Oakham. Pretty happy about that.
I hated the night labs. Like, you run out from practice, like you're still chalky, you're still like super gross, trying to like shove any type of food you could in your mouth.
Yeah.
Like barely making.
You're wrapped in ice trying to get
and then you're like leaking ice and water everywhere.
Yeah.
Oh,
man.
What was everyone's sort of favorite, either academic memory, but I bet most people have better gym memories from being at DU?
I think it's hard to like pick one. I don't know. I feel like you just have a family from there, and you're lucky enough to have had that throughout your time there, and to still have that over 10, 13 years down the road. That's a pretty cool aspect of it. Gym memory, my freshman year when we went to Penn State and won, that was pretty awesome in regionals and made nationals. It's a good gymnastics memory.
Yeah, I was gonna say,
Go
sorry.
ahead. No,
My favorite memory was my senior year when we won at regionals and got to go to nationals, and then made Final Four at nationals, which was really awesome. Or I guess it's called Four on the Floor. I don't really know, but that was just the best, absolute best way I could imagine of going out. So that was my favorite.
Yeah, absolutely. It was fun to watch too.
Yeah, definitely. What an exciting year.
Very, very exciting.
I think just travel in general, you know, it definitely, sort of alluding back to the Friday classes that you missed, it, you know, was challenging, but that was always my favorite part. I love being on the road. I loved, you know, obviously it's super fun to have home meets, but I loved traveling with the team and roommates and just, you know, laughing on the bus or whatever. But I guess probably the best memory was my sophomore year regionals at home, that we made it to nationals in front of the home crowd, and just sort of celebrating with everybody and the hype that was around that team. And it was a very good team. Everybody was super excited and got along really well. And it was a really fun team. And that was probably the best, but just all the travel in general, I think that's probably the part, you know, I think there are a lot of people that come out of NCAA sports that really have a difficult time sort of transitioning into post-sports world. And I think for me, that was the part that was the hardest to grasp, is that sort of team atmosphere and the fun that came with that was kind of gone.
Yeah, nothing like it, that's for sure. Like very special. I would say my favorite I also love traveling a lot. I was actually just thinking about like traveling on the road, and like with COVID and everything, I was like, wow, it's gonna be like really different, or you know, just everything's changing obviously. But yeah, I just remember like going to all the different like food and dinner places, and like we were so fortunate with all that, and it was a lot of fun. I really like doing now I can't remember what it's called. Grace, you might remember the like aerobics, or
I forgot about like aerobic, like I don't know,
dance. So fun. Like I feel like I was always laughing, you know, when we
Always.
always made these like,
When you
stupid
all were
themes
there, were
up.
they
Like I
themed?
remember,
Like, was it
yeah,
really
we would like
themed?
pick,
Yeah.
yeah, like the funniest one that I feel like we did was in Idaho we did a potato dance,
Oh.
and like everyone
I heard
picked,
about
like,
that actually.
different potatoes and made it as like dance moves. That was like pretty funny. So yeah, just silly things like that, I guess. And then I felt like my senior year was most special. I mean, all the years had special for other reasons, but yeah, senior night was just really special. And I don't know, the team was just very connected, and yeah, I don't have any one particular memory. I feel like it all kind of blurs into one, but
It'll be interesting to see what the NCAA does with sports this winter. I really hope it's not a one size fits all sort of mandate. 'Cause I feel like gymnastics can be done very safely. It's essentially one individual going at a time, right? And
Yeah.
so I feel like it could be done in a very socially distant, COVID safe way. So fingers crossed for this season. I can't imagine the seniors last year and then the juniors last year not going into senior year with that kind of uncertainty. I mean, all the hours and training and, goal setting and everything sort of ended so abruptly. It would be just really hard to sort of swallow that and move on.
I know, it puts you into perspective. Like, I feel like I was super sad as a senior, like being done, but like I got to finish the season out. Like, there's always something, you know.
Yeah.
When's the last time everybody got to go back to DU, to campus?
Well, I lived there all last year, so I was there in July. But
I went back, shoot, I think when Nina was a senior, I don't know if,
that was 2016 because it was my freshman year. So
Okay.
2015, 2016, yeah.
I think that was the last time I saw a home meet. There might have been another time. But then I went to, when you guys made it to nationals, Grace, I went to that where was that again? Texas?
Fort Worth, yeah.
Yeah,
Mhm.
that was super fun.
So much fun.
Really exciting.
Yeah, the last time I was on campus was actually I went with Louise, and it was October 2018. So that was the last time I was on campus. But I also went to nationals and watched you guys. That was really, really awesome.
I feel like I'd gone back to several different alumni events, but I don't know when the last one was. It's probably been 4 or 5 years or so. I want to say I was maybe just starting residency or something. I don't know. So it's been a while, but always excited of a chance to go back. So love to
I know
see
they updated all of the science buildings and
Oh, really?
everything. It looks so nice.
Really different.
I'm like jealous.
Yeah.